Welcome back to a mini episode of Cancer Buzz. I'm your host, Summer Johnson. Today, a fresh idea to address connection and mental health among oncology staff. Early in the pandemic, the Stanford Healthcare Radiation Oncology Department was looking for a way to connect and support staff and to boost morale. Dr. Kathleen Horst, senior radiation oncologist at Stanford Healthcare, spotted the need and created an internal podcast just for the radiation oncology staff. The podcast is called Table Talk. Our guest today leads the self-care segment for the podcast. Jenny Kwak is a clinical social worker and holds the unique role of radiation oncology behavioral health clinician in the department. Jenny, tell us about the birth story, if you will, of Table Talk.
So that's actually a great question because I'm sure a lot of people are interested in how podcasts can get created in departments. And it's something that Dr. Horst, Maddie Minetti, Jamie Carl, and John Valentin, staff here, Dr. Horst is the lead on the podcast. They thought that the beginning of the pandemic and the shutdowns, like people still needed to be connected. Our department was interesting that some people were working remotely and they really wanted the staff to stay connected. And what better way to have podcasts so that people can listen in even if they're working from home. And so the Table Talk with RadOnc was created.
Jenny, we talk a lot on this show about making the business case for supportive care services. Do you think that Table Talk has done anything to move the needle to recognize the value of supportive services?
I think that there is acknowledgement for the need for increased support for staff to embrace our ability to be resilient during this pandemic. I think that there are a lot of programs at Stanford, like the Cancer Supportive Care Program for patients. But for staff, we have things like the Healthy Steps to Wellness that I've been a part of, and that's hospital-wide. But for staff here in radiation, I think that it was a great idea that Dr. Horst and the podcast committee were able to create a space for people to share ideas on how they cope with stress. And, it's really survival strategies at this point. We're, 18 months, 19 months into the pandemic, and we still need that support. So at the beginning, it was every week, but then it became monthly, and now it's quarterly. So, we're mindful of our time and our bandwidth.
What kind of feedback have you received from your colleagues in the radiation department?
Well, I have been well supported by some of the staff who have stopped me in the hallways to say, oh, I really liked, that segment, or I really liked how people were interviewed. I was able to get a couple speakers, Dr. James Doty, who's a neurosurgeon here at Stanford, and Dr. Christopher Willard, who is a Harvard lecturer and a well-known author in the mindfulness space. I was able to get him to be interviewed. So I got to interview a couple of my personal mindfulness heroes, I guess, and they were great. So we got to have a platform where the podcast can be multiple things. It can be staff engagement. It can be interviewing them. It can be sharing, strategies for self-care. It can be, really having topical discussions. We had a panel on Stop Asian Hate. We had a panel on diversity. We had a panel on systemic oppression. So there was very key topics that you can have during panel discussions for a podcast. You can have a variety of, excellent speakers and people who you can learn from. So that was why I really have enjoyed the podcast.
Another big topic in the oncology community is staff resiliency and supporting the mental health of our staffs, especially right now, before the pandemic, and then it's been so highlighted, obviously, now. How has being a part of Table Talk lifted you up for your day-to-day duties?
Well, I can be honest about that. And I think that during this pandemic, we've all had ups and downs with coping with stress ourselves, whether it's our family losses or, being in the midst of a pandemic, being on the front lines of healthcare. I know that the staff here that support me, that I feel I can support, keep me engaged. The patients, too, have been incredible. And so I do share, without sharing any demographic information, I do share some of the highlights of my work with my patients. And I shared at the National Short Center rounds, too, and the compassion for healthcare providers. We have a lot of healthcare providers around the country sharing like how this time has been very challenging, but what we can learn. So I've learned a lot from my patients because we learn constantly from our patients, right? And staff too. If we can encourage staff to be engaged and value the work and find meaning and purpose in this work, that's been helping me to stay afloat during this very challenging time. I've done several talks on steps to self-care in a variety of cancer forums, a variety of Asian and Pacific Islander social work council forums, and it's all a part of our wellness. And if anything, COVID highlighted that mental health is just as important as physical health.
The Table Talk podcast remains popular among staff and runs quarterly. You can find resources related to today's discussion in the show notes. We'll be back again next week for a special conversation on the pandemic's impact on diagnoses and treatment for cancer and the road to recovery for the oncology community. Until then, for the Cancer Buzz team, this is Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.